Health Organization just declared this a global health emergency.
At least 6 states banning large gatherings of people.
This is what the healthcare workers have resorted to. They're wearing garbage bags.
They decided to evacuate 78 of its residents and move them someplace new.
The COVID-19 pandemic and an increasing number of natural disasters show us how devastating emergencies can be to nursing home residents. Nursing homes present unique challenges, as many residents have neurological impairments that can make crisis situations especially confusing and stressful for them. This stress can result in resistance and challenging behaviors that can be difficult for residents, staff, and first responders. This video is designed to help nursing home administrators be better prepared to provide person-centered, compassionate crisis care during emergencies and disasters when every minute counts. As nursing home administrators, we play a critical role in how our facilities function. I know it can be challenging to manage during crisis situations, but our leadership sets the tone for how our facility operates, how our staff performs, and ultimately, the care and safety of our residents. In this video, we will share some lessons learned from previous disasters and the COVID-19 pandemic, and we'll suggest some leadership practices that can help you build a strong and resilient organization, better able to provide the person-centered care that residents so desperately need. First and foremost, stay on top of the latest regulations and requirements for emergency preparedness. Stay connected to your state and local public health department. Participate in their drills and training exercises and take advantage of all of the resources they have to offer, including PPE and test kits that are made available during medical emergencies. Practice drills and training exercises are extremely important to prepare your facility for future emergencies. The goal is to practice carrying out emergency plans in real time to make sure they work as envisioned, and to ensure that each person understands and is trained for their role. Practicing how you will respond during an emergency also helps build trust and staff confidence in decisions made by management about how to cope with crises. You may need to go above and beyond the number of drills and training exercises required by regulations. For instance, when there is a forecast of a serious weather event, go over your emergency plan with your employees and staff. Review your resident census and make sure any new residents are included, particularly if they have cognitive impairments. Make sure emergency plans are readily accessible to staff and first responders. Don't rely on binders or notebooks containing emergency plans stored in offices. Put key aspects of the emergency plan in places where people can find them quickly. Remind staff about the importance of person-centered care and crisis intervention techniques during emergencies and evacuations. This will reduce stress on the residents, particularly those with cognitive impairments. Set up first responders for success in assisting residents. Ensure that staff communicate information about residents with challenging behaviors to first responders, as well as effective calming interventions. If evacuating to another facility, make sure to pass on the same information to the receiving staff so residents can receive appropriate care from the start.
A nursing home's success in weathering a crisis is also highly dependent on good leadership. Authors and healthcare consultants David Farrell, Barbara Frank, and Kathy Brady worked extensively with nursing homes after Hurricane Katrina and COVID-19. They wanted to learn from facilities that did exceptionally well in crisis situations, those with the fewest deaths, the fewest illnesses, and the fewest staffing problems. Barbara Frank shares more about what they learned.
It turns out that in New Orleans after Katrina, and throughout the country during and after COVID, the common element that made the difference in how nursing homes did was how leaders acted. The leaders who created a sense of community, who cared about their staff, and who worked together to solve problems as they came up, had the best results.
Here are some of the leadership practices that you can do that will help during crisis and beyond.
Be visible, be accessible, lead by example. When staff can count on your presence out on the floor, they're going to be able to know that they can tell you what's going on, they can hear from you what's going on, and it gives them a sense of stability that allows them to do their job. do more rounding, to check in on people, not to check up on people, to be available to them and to have them know that your presence is something they can count on.
In interviews after Hurricane Katrina, nursing home staff comment on the difference this made.
It wasn't about I'm the administrator, so I can just dictate. I have to show them, and I have to help them, and I have to encourage them to be the very best that they can be under this circumstance. Because the only way we're going to make it is we got to make it together.
Take care of your staff. You're in a caregiving business, and when you take care of your staff, they're able to have the peace of mind to be able to take care of your residents.
Some examples include providing staff with mental health first aid training. Also, providing rooms on site for staff who had lost their homes during Hurricane Katrina, or for staff who were worried about spreading the COVID-19 virus to family members after being exposed.
Those nursing homes that invited their staff to live in the building, those nursing homes were never short-staffed. In COVID, there were some nursing homes that never used agency. There were some nursing homes that didn't have to pay huge bonuses out to their staff to cover for different shifts. When their staff felt taken care of, they showed up. They were committed. That mutual commitment allowed the nursing home to have the continuity of care and to have their residents being taken care of.
We didn't have to worry about a lot of things because they took care of it for us.
And when your staff is happy and they're content as they could possibly be at a time like that, they're going to take good care of the residents and it's going to convey back to them. And that's the bottom line.
Communicate with your staff. One of the best ways to communicate is through short huddles. You bring together people with clinical knowledge and frontline caregiver experience to deal with emerging issues or problems with vulnerable residents. You listen and invite the group to problem solve in real time together and come up with new solutions as a team.
You might have a situation in a crisis where a resident with dementia is being very activated by the tension. You could see that that resident is starting to show distress. And if you talk about that in a huddle, you might have a staff person who says, you know what, they're very religious and I sing hymns. And when I sing hymns with them, they settle down and these are their favorite hymns. Not everybody would know that. Oftentimes staff have their own way that they go about making something work for a resident and they don't have a forum for sharing it. When staff feel like they fully understand what you're dealing with and that their contributions to the ideas matter, they're going to put their full energy into figuring out what's the best solution.
Encourage creative thinking and be open to new ideas, no matter where they come from. In times of crisis, innovation and creativity may be your saving grace.
One example is staffing. We were talking with one nursing home that had an incredible scheduler. That scheduler knew everybody's life circumstances and was able to make schedules that would work for each person. Sometimes it meant having a staff person say, I can give you 4 hours, but then I need to get home to put my kids to bed. And somebody else can say, I can pick up those extra 4 hours as long as I'm finished by this time. That way of being person-centered to the reality of people's outside lives allowed them to be able to be fully staffed and not miss a shift. Those are the homes that were able to avoid using agency because the staff were so committed to being able to take care of their residents, but they also felt like the administrator and their DON were committed to their being able to take care of their families.
We became leaders. We were empowered in some way.
Everyone has something to offer, and you value their opinion.
And we've carried that forward a lot since we've been back. When we're making policy change or big decisions, we'll invite the people in who it's going to affect and say, how will this really affect you because you do the job day to day? And oftentimes, very often, they'll have a better idea than what we had because they know in a practical sense how it's going to work.
This type of leadership can be described as person-centered or high-involvement leadership and is related to servant leadership.
Staff appreciate clear leadership from the administrator and the DON, and they also appreciate having a voice. High involvement leadership taps into the commitment and the wisdom of your staff and brings everybody's ideas into the mix as you're trying to navigate a difficult situation. It puts you in a position where together you can figure out how to keep doing what's working and how to address what isn't.
Remember, your leadership makes a difference. You have the ability to create a nursing home where employees and staff feel valued and are able to provide consistent and compassionate care to residents, both during an emergency and beyond.